let's get started with Bridget. For those of you who haven't listened to our show before, Bridget is the Director of Marketing and Community Outreach for HAP in their Mid-Michigan market. Hey, Bridget, how are you doing?
Great. How you doing?
I'm good.
Good.
So I understand that today this is an all men's health awareness month,
right?
I think, right?
Yeah.
So we're going to talk about trying to get that guy of yours or for you men out there, to get in and make sure you're taking care of your health. So
absolutely. June is Men's Health Awareness Month, and so we want to focus on that and get folks in to see their doctor and to get all the tests and all the screenings that are so important to get.
Sure. So, it's really... guys are really not the best about going to the doctor.
No, they're not. Historically, you'll hear guys say, and it's really true, that men seem to be more hesitant to go to see the doctor when something is wrong or they think something is wrong. And they're also not as likely as women to get those preventive screenings and get their checkups. And that's kind of scary because, we've talked about this before, but early detection of medical issues is really the best way to improve their condition and to make sure that the treatment and management of that issue is handled as best as possible. And it really is an important topic, and that's why the month of June is dedicated to men's health awareness.
All right. So make sure you're listening in for the next few minutes. If you don't plan on staying for the whole show, at least get the next few minutes because this is very important. You're going to kind of go over with us what screenings that men should be sure to get at certain age groups, right?
Right. So to start out with, if you're in your 20s or 30s, this is really a time when you need to start thinking about having an ongoing relationship with a primary care physician, and that's family practice, internal medicine, someone who can handle your overall health. They'll be able to send you to specialists if need be and so forth, but really having a trusted health professional who knows you, knows your history, knows what's going on with you, and can talk to you about health concerns really makes it easier to stay on top of all that stuff that you need to do. So at this stage in your life, the 20s and 30s, you really need to start looking at biometric screenings and early detection of certain things. And so some important aspects of that, vaccinations, that's been a huge topic of conversation. An annual flu shot, super important. A tetanus booster you need every 10 years. And I'm going to say it again, if you haven't gotten your COVID-19 vaccine yet, now would be a great time to do that.
Yeah, and tetanus, that's very important, especially like if you're in the construction field or something like that.